conflict of interest. Where are we now in early diagnosis of neurodegenerative
Come closer
disorders?
to the mic, please. Thank you.
Neurodegenerative diseases are conditions that can affect the central and peripheral nervous system, leading to cognitive motor impairment.
Slides are not coming. Slides are not coming.
Slides are.
Yeah.
So these have become increasingly prevalent because of the increased aging population worldwide. So the currently used diagnostic tool for diagnosis of NDDs are MRI, PET, and other tests, which are expensive, invasive, and difficult to assess in developing countries and unsuitable for population screening. So coming to OCT, is it a newer tool for diagnosis of NDDs? The retina shares embryological, histological, biochemical similarities with the cerebral cortex, thus making it a uniquely promising biomarker for NDDs. As we all know, OCT is a modern non-invasive technique that provides high-resolution 2D cross-sectional imaging of retina and optic nerve head. These are the various studies which are being published as OCT in patients of Parkinson and other NDDs. But there's paucity of studies on correlation of cognitive severity with OCT parameters. So our current study will add to the knowledge. Our aims and objectives are comparative evaluation of GCC and RNFL in patients of NDD with age-matched control, and to evaluate the correlation between the cognitive severity and OCT parameters. This was a prospective, non-randomized observational study done at RIO Patna, and cases were selected from neurology OPD and controls from RIO OPD. Study period was 1 year. These are the inclusion and exclusion criteria. So cases were diagnosed by neurologists, and they did a complete physical and neurological examination, and then cognitive tests was done using MMSE chart. So these are the questions being asked to the patients, and then accordingly they were being graded in mild, moderate, and severe cognitive impairment. We did a complete ophthalmic evaluation, and swept source OCT, RNFL, and GCC was done. Coming to the results, there was no difference in mean age between the two groups, but there were more number of males present in both the groups. There was reduction in RNFL and GCC thickness in cases compared to controls, and that was statistically significant. The thinning was significant in all sectors analyzed. Our results of study corresponded with the results of Enzelberg et al. And Verghese et al., which also showed significant thinning in RNFL and GCC in cases compared to controls. This is a paper on retina as a window to the brain, which shows there is perifoveal dopaminergic plexus deterioration in patients of PD, which leads to the thinning of the RNFL. We found a positive correlation of MMSE score with RNFL and GCC thickness. Similarly, Khanna et al. Found positive correlation between the two. So to conclude, NDDs are devastating conditions with insidious and relentless progression. So there is need for early detection of diseases prior to severe symptom onset. OCT being relatively quick, non-invasive, inexpensive, and easily accessible tool for diagnosis and progression, it can serve as an ultimate biomarker for disease diagnosis and progression. So limitations of study are there was motion artifacts which may have contributed to errors, and the tremors in patients led to poor fixation and poor image quality. Patients with severe cognitive impairment like MMSE score below 9 were unable to perform OCT, and our study period was short, so we couldn't study the progression of the disease and the effects of medication with OCT parameters. Thank you.
There are studies already available in the structural changes present in Alzheimer's. So, what does your study extra add to the literature?
Actually, ma'am, there are many studies, but there's paucity of studies on this correlation of cognitive severity with OCT parameters.
Did you find any particular pattern of structural changes which was present in Alzheimer's not described prior? Any pattern of change in the vascularity?
There are few studies which show this positive correlation with they have used different grading thing like UPDRS for Parkinson, but we have used this MMSE grading for cognitive decline, and then we have compared with OCT parameters. There are not much study on this comparative evaluation, ma'am. Just one study that has compared MMSE with OCT parameters. So this was.
It is the RNFL or GC IPL with the cognitive decline.
It should be GCC, ma'am.
It should be in what in your study?
My study has showed actually both the thing, ma'am. In RNFL
Both
and
the better one, which is correlating more? You
ma'am,
must have found out the coefficient factor. They find out to see the more correlation.
we didn't see that, check for that, ma'am, but we have found both, there was reduction in both the thing, and that was
Thinning in
statistically
both,
significant.
which has a more thinning and was more correlating with the fall in the cognitive function.
In cognitive severity, ma'am, more GCC, we found cognitive, this
Correlation, but you didn't show the correlation table.
positive correlation in more in GCC, ma'am.
Okay. And you use the mini mental scale. This is a very crude way of assessing the cognitive function. It's a scientific work. You should have used a better scale for
Yes,
assessing
ma'am.
the cognitive functions.
Yeah, many other things are available, ma'am, but
Mini mental you do in OPD, just quick
Sorry, ma'am?
workup. Mini mental you use in the OPD,
OPD,
just
neuro
for the quick
OPDs.
assessment of the neurological overall status of the patient. Okay.
Yes, ma'am. Ma'am, 80 patients and 80 controls.
You have not mentioned it in the slides. So, which all diseases have you covered? Because your study period was very short.
Yeah, it was short. So we have included Parkinson disease and Alzheimer's disease and mild cognitive impairment patients.
But then you have, like in the
Need a
title,
chart.
you have written neurodegenerative diseases. Other diseases are also included, no?
Yes, ma'am. But most
And
of the patients
rest are
were
not common in India.
yes, most of them were Parkinson patients and rest were Alzheimer's.